The nasal tip is made up of two paired cartilages as seen in this photo. Of particular concern is the infratip lobule, or the area near the bottom of the nose. When this is full, it can be an area of significant cosmetic concern for patients. This represents the area of the cartilages as they bend from their high point down into the columella, or the strip of skin between the nostrils. This patient here has a full infratip lobule with some asymmetry, as shown with the overlying drawing of the two paired tip cartilages. Correction of this is a key component in correction of her overall aesthetic concerns. As seen on front view, there's a downward displacement of this segment due to cartilage asymmetry and round projection of the cartilages. Suture and cartilage grafting in this area produces flattening of the infratip lobule, which produces a very aesthetically pleasing way of shortening the nose on front. On profile view, this will be seen often as excess columellar show, which appears droopy to many patients, especially when they smile. Correction improves this aesthetic tremendously. This can be seen on multiple views, and for many patients, this 3/4 view is the most important, as this is the view often seen in photography. The overall improvement in the profile and other parameters acts in a harmonious way with the shortening seen from infratip lobular compression. Here's an example of another infratip problem which is less profound. However, correcting this in the aesthetic rhinoplasty is critical for improving the front view without producing extra visibility of the nostrils from front view, which is something many patients want to avoid. Another example of an infratip lobular problem where compression of this area as well as correction of other parameters shortened her nose in an extremely pleasing aesthetic way. The most natural profile is one in which the infratip is compressed but not rotated. Here is a revision patient where the infratip was not addressed in any manner in the primary rhinoplasty, resulting in a significant imbalance of the upper and lower nose. Primarily, correction of the infratip produces a significant improvement to the overall aesthetic of the nose. This is seen at 2 months postoperatively. Imbalance between the infratip and the nostril produces a hanging columella, which makes the nostril more prominent. As seen in all views, especially 3/4 views, the overall appearance of the nose is much more harmonious. Finally, another primary rhinoplasty result where the infratip compression produces a very narrow-looking nose without it being pinched in any way. And the profile is perfectly proportioned in the shape of a 3-4-5 triangle. As you can see, tip surgery is a critically important part of a successful rhinoplasty outcome. In order to make the nose look natural, it's very important for the upper nose and the lower nose to be balanced. One of the things we do often is infratip lobular compression. Tip surgery is not simple. It's a three-dimensional operation. It's not often just about trimming something or pushing something to one side or the other. To change the shape of the tip, you often have to use cartilage grafts and sutures in order to control the shape so you can predict the outcome. This is one of many things that we've been perfecting over the last 15 years. It's a way of shortening the nose without causing excess rotation of the tip, in which from the front view you're going to see too much nostril. This is what our patients want, and they really love these types of changes. This is what we look to accomplish in every operation. And I think it's one of the things that sets us apart from other people that perform it.